All right, so my name's Christine Price, and I'll tell you just briefly my background. So I have a background as, I was trained in master's level psychology and worked as a school psychologist for a while, and then developed my own private practice in 2007. So I've been doing that for, what does that make, about 7-something years. And I finally got my very own office this year. So 2014 was really big for me because I got completely on my own, and so that's been fun. It was a little scary, but it worked out well. So I'm going to be talking a little bit about my whole history with mental health and what I've learned in my personal experience as well as professional experience. And I'm going to share kind of how they're unique. They're similar, but they're different. So I'm also a certified life coach, and I took that certification on a few years ago, and I found it actually freed me up to do a whole lot, and it's going to tie in with mentoring as we talk about mentoring tonight. So I'm going to talk about emotional health, and as you see, you've got this little chart on the left, and we're actually going to start from the bottom and go up, all right? Do you see things in life do that? Start from the bottom and go up? I think if we were talking about progression, that's what we're talking about tonight. So you'll see that. All right, so I'm going to draw a little bit of that on this board, and you can use your handout. But we're going to start with the 100 level. Okay, so as we start with talking about the 100 level, mental illness and addictions are all consuming at this level. And individuals at this level are not functioning in normal life. And so as I worked in, I didn't mention that, I worked in substance abuse for about more than that. I started working in substance abuse in the 90s. So before I got my master's level, I was a substance abuse counselor, and I learned a lot about the 100 level. I was actually working with a lot of people in outpatient settings, so they weren't that dysfunctional. But that was what people pictured. So when I would ask them to tell me what does an alcoholic look like, they would always picture someone at a 100 level. So what does that do for you psychologically? If that's what a problem looks like down there, then what? Then you're okay, right? Because you're not there. So you're fine. Okay. So that was typically what I would see. And mental illness the same way. So when someone starts to think, oh, I have, depression or anxiety, especially 20 years ago, they didn't want to admit that. They stayed in denial because of this vision or this viewpoint of what does that look like. And it looks like this 100 level. So some examples of that are people that are on the streets, or people who have depression so bad that they can't get out of bed and they've quit their job. Or people who have anxiety so bad that they don't leave the house and they have to have people come to them. And I have seen that, and it's a scary thing, and of course that's not as common. But when we have a mindset of that's what that looks like, what mental illness looks like, it kind of sometimes it prevents us from actually dealing with what we are dealing with. Okay, so our reality. All right, so we're going to move up. So now as we talk about a 200 level, let me tell you a little bit about these levels. So these levels actually come from David Hawkins. Is anybody familiar with that? I've read the book Power versus Force. Is that familiar, sort of, kind of? Not some. I see some nods. Okay. So I have a whole class on just frequencies. But that's what we're talking about, is frequencies. And so he has, this is a neuropsychiatrist who actually worked in mental hospitals, worked with 100 level people, and looked at what's it going to take to shift them. And that's what he discovered is there's these different frequencies. And in order to shift somebody out of a mental hospital, you've got to shift their frequency. So if we're talking about a 100, that's mental hospital stuff. And really, that's the solution, is to get up to a different frequency. So, okay, so let's talk about a 200 level. So at a 200 level, people have mental health issues and dependencies, and they're in a holding pattern. So the individual kind of remains stuck in that. They have maybe just kind of a mild addiction, sort of. And a lot of times these addictions are to things like prescriptions, or to the drugs that aren't quite as bad, as the others, or to food. But they're just stuck in that pattern, and they seem to go around and around in circles and don't seem to get out of it. And so that's common. What David Hawkins has said is that 200 level is a pretty much average for our population. So a lot of people are around a 200 kind of stuck in their stuff and not really moving too far, too fast. So mental health issues at a 200, what that looks like is kind of that mild depression that just kind of keeps coming back, and it keeps you from really living the life you want to live, or that anxiety that keeps you from doing that thing that you've always wanted to do. And so you just don't move with it. Okay, so let's talk about 300. 300, I think, is the most common one that I see. So 300 level, you have people who are functional, all right? So we like to see functional people that are, contributing to society and doing good things. However, it's very common that someone at that level has mental health symptoms and compulsions that are in the background of their life. Their life functions as long as those problems stay hidden. And that's their job, to kind of keep it in the background, kind of keep it hidden. So I mentioned this to a lady that I've been working with for a while, and she was like, that was my life for 20 years. She went to therapy, she held a job, and she would call into work sometimes. She'd have to call into work because her whatever depression was worse or something was worse, but she'd never tell them that that's what she was dealing with. She would just call in sick. And I call it compulsion because it's not full-blown addiction a lot of times at a 300 level. But you're dealing with something that you're turning to that, and it's not really a solution, and you kind of keep it hidden because you don't want people to know that that's what you turn to. So 300 level it's an interesting one to shift from because things are functional enough that a lot of times there's not a huge motivation to change it. So I think and I see some smiles, that's common, right? It's like, it's okay, we'll just leave it alone. It seems, at a 300, it seems like it would be worse to really deal with it sometimes, to let it all out or to come out in the open with the problem, than it is to just kind of keep it under wraps and not shake the boat or rock the boat. So that's the one I see, and that's a hard one to move out of because it's kind of comfortable. People are in their comfort zone in a 300 level. Now, when I use this in the other lecture, and I talk about, that was kind of what I thought life was growing up. It's just those 3 levels, and so it's like, that's life. Well, for me, I had this kind of deeper soul, and it just didn't resonate that the 300 was all there was. I saw a big nod back there. Can you feel that? For some of you who have been doing life and wondering, looking around you thinking, oh, you're supposed to just function at a 300, not supposed to be good enough. And inside, that's not enough. It's not okay to just be there. So what do? You can feel it from me. You start feeling. And that's really what shifts you up to a 400. Sometimes you don't start feeling until you drop down. So in my life experience, I had to drop down first and get to where it was pretty unpleasant and get that motivation, and that propelled me. And that propelled me up, and then I started to move to the 400 level. So what else would be a catalyst for someone to shift out of a 300? Nice comfy place. Any ideas? How about a crisis? Yes, a crisis of some sort. Here's the interesting thing I'm seeing in my practice. So I've been doing this for a while, and like I said, clear back in the early 90s, I was working in clinical study. Here's the thing I'm seeing, is that I'm seeing 300 level people having crisis more and more often. So it's not the ones that are way down here that are coming in, it's the ones that have been functioning, and all of a sudden, they can't get that anxiety to go away. Or the depression is just too heavy, and they know that if they can't keep doing it. And so it feels like a crisis. And sometimes there is another life crisis that comes up, like a loss of something big, either a loved one, a divorce, loss of a job that really throws them. And so usually there's some sort of a crisis, some sort of a catalyst that will push somebody out of that 300 level. So it looks like mental health symptoms sometimes. Sometimes it's really just emotions. And really what I found is that people who try to push down their emotions, well, guess what pops up? A mental health issue. Does that make sense? Or if people try to push down their emotions, then what pops up is a little addiction. Now they can't quit that chocolate or whatever. That's mine. It's the chocolate, but anyway. So, and I go to the chocolate instead of dealing with the emotion sometimes, right? A lot of people are familiar with that. So when things get uncomfortable enough, then we have to do the emotions. And people avoid emotions. I have so many people that just don't want to go to 400 because that's what 400 is about. It's about releasing emotional energy. and shifting those symptoms through the expression of the emotion. But at the 400 level is where you also find the truths about wellness, a lot of the truths. So here's what you see is somebody at a 200-ish, 300-ish level goes into a doctor and says, I have these symptoms of anxiety. And what does the doctor do? Hands them a medication. And how well do they become? Are they all of a sudden magically cured and life is beautiful? And they move on? No. I have never seen that. I'm sorry, I have a lot of energy about that. Never seen it. I've never seen someone go in and get a pill and have it fix them, really. It masks symptoms. So the emotion that's behind that has got to go somewhere, and it's got to, and that's what creates the shift. When someone's ready to do it without meds, without another, dependency or whatever you want to call that, it gets uncomfortable, but it's what works. When I see someone start to do the hard work of moving up to that next level, then they also a lot of times will find a real solution. Oh, I have this sweet client the other day. Finally came in, her heart had just totally changed. And then it was like, why have I not told you this before? She was trying to quit smoking. But I had never thought of it before, but you know what had to happen first? Is that change of heart. And so that's a lot of times what happens at a 400, is that we have a change of heart that propels us into a whole new territory. And that's where we get the real solutions.